Hi, everybody.
Hi, Janie.
Oh, look, we have Brandis and
Janie.
Rebecca. You guys, I was just thinking about you today, and here's why. I have a big container of books, Imagination Library books, you know, when they get returned to the post office, and he brings them to me. So I called Kate. I wanted to just drop them off at the library. Rebecca, you're not there anymore, right? So you are still there.
Yeah, and I think Kate's out today or working from home, but it looks like Rebecca's in her office. So
are you,
she's at least
Rebecca?
there.
So if I want to bring them down like later today, I could just drop them off on your back ramp.
Yeah, definitely. Let me all. Do you want my cell phone number? You could text me when you're here.
Okay, sure. I just wanna drop them off really quick though.
Yeah.
Other times when I've arranged to meet people, like I was out there knocking on the door and nobody came and stuff. So, but yeah, I could definitely shoot you a text before I came.
That'd be great.
Okay, cool. What is your number?
541-659-3083.
3083. For some reason, I thought somebody told me you weren't there anymore. It's good to know you are.
Well, I'm not working for the district anymore. I'm now working for the Library Foundation, but I'm still in the building.
Okay, great. Well, I know we love getting these extra books, so, and I got a big pile of them today. So I'll get those over to you guys later today.
Awesome. Thank you.
Thanks,
And good
Jeannie.
to see both of you guys.
You too.
Is anybody talking or are we all off?
You are.
Yeah.
Okay.
That's good.
Guess what, Steve? You can't check into the September 30th meeting yet.
Really?
Yeah, I kept trying.
Okay. You know, I wondered about that when I did that at the top. Then I thought, oh man, doggone.
Yeah, I thought we were going to do a little time traveling. I'm disappointed.
Well, stay tuned for next week.
Okay.
How's everybody today?
Good.
I just had a Pilates class. It's great. Every part of me is fluffy from my having breakthrough COVID and then a week in Hawaii. So I'm back. Look out.
Oh, Brandis. Hey,
Hi,
Brandis.
Kelly.
Hi.
I saw you pop up. It's always good to see you.
Oh, you too. I'm so glad you're speaking today.
I know. I'm excited to talk to you guys about all the fun stuff we're doing at the library.
Oh, yeah, absolutely. Yeah.
Kelly, how'd things go at Foundry Village this morning?
We're done.
Okay, so I don't have to go this afternoon.
No, you do not.
All right.
It's so awesome. I can't even tell you. So many volunteers showed up yesterday that we got all the bark spread. It's
That's great.
amazing. And I went over today with Lisa to try to, because the little emitter things that come out of the feeder lines from the irrigation, we wanted to make sure they weren't all, clotted up with bark. But they're Moser is there doing all this paving in the parking lot and tarring and whatever. And so we didn't stick around for very long.
Yeah, okay.
But yeah, I got some great pictures.
Good. Well, I thought if I came this morning that Doug would make me dig post holes. So,
And you would have, or
Okay.
caulk, or you'd have been with a caulking gun.
okay.
Yep. Yeah.
What are they doing this afternoon?
I think they're getting prepped to paint the insides of all the tiny houses.
Gotcha. Okay.
I think
Ooh,
that's
I
what's
wanna-
going on.
I want to come and caulk. After years as a pastry chef, I'm a badass caulker.
Oh, you need to do that then.
I can really control that caulk like pipe and bag icing.
I love that.
I just want to know, did you use caulking in your pastries?
Yeah, let's hope not.
For gingerbread houses.
Oh,
Okay.
Oh, that's good.
hey, Kate, I'm liking looking at your background and seeing your whiteboard.
Oh, I know. I want a really big one. I have a whole big wall for it. I'm all
Oh,
about the whiteboard.
good. I know you are.
Then I want suction cup darts so that when I get kind of stuck, I can just throw a suction cup dart and like, I'll do that now.
That's a great idea.
Oh,
Well, they
I
have
can so relate.
they have some paint that you
Well,
can
it's
make
a-
into a wallboard.
Mm.
Hmm.
Well, what do you think? Should we kick this
Steve?
meeting off at 12:01? I think so. I'm gonna mute everybody.
I was going to say,
Mhm.
Steve, do you mind making Gina Marie and or me a co-host?
I will do that.
Thanks.
We'll do that first. Okay. That is done. Okay. Okay,
You okay, Steve?
I'm a good. Okay, it's done, accomplished. Okay, we'll start with our car horn. Okay. Open the meeting and Pat Bath, would you please lead us in the pledge?
We don't have a flag, right, Gina? Would you join me in the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, Pat. Inspiration, Susan Fisher Mackey.
Hi, everyone. Okay, so most of you know that I work in systems and even inspiration is systemic for me. So I have 3 parts to this. The first is just show up, be brave, be kind, rest, and try again, which made me think about the word rest. And here are some ways to rest. Take time away, do something unproductive, connect to art and nature, find moments of solitude, take a break from being responsible, and be still. But I also want to be a realist. And so here's my closing thought. I used to just procrastinate, but I was so good, I went pro. So oftentimes we procrastinate on resting and doing things that are good to take care of ourselves. So thank you for the next hour plus that we'll get to spend together and how that will fill everyone's buckets.
Well, what a great way to start our meeting and our day. So thank you very much for that, Susan. Visiting Rotarians, Tim Lemons is here and he is proposed for membership. We did our first posting for him in the Navigator last night. So welcome, Tim. Are there any other guests or visiting Rotarians? Okay, well, hearing none. Asante Healthcare minute. We're going to hear from David Kenyon. When are you?
Yeah, when is in. Yeah, so good afternoon,
Welcome.
everybody. So it's my pleasure to introduce David Kenyon. He's our Vice President of Operations at Asante Three Rivers Medical Center. I've had the pleasure of working with David actually for the last 19 years. He's an excellent person and a great leader, and I'm going to turn all of my time over to David. Excellent. Thank you so much for having me here today. I'm going to share some slides, and there's quite a bit of data on this, and we're going to go through it kind of fast, but there'll be room for questions if you'd like. I'm sure many of you probably seen this this infographic. You know, we're posting this on our website, and there's a lot of information on this. And the good news is I have good news today. So we are looking much better as a community and as a health system in terms of COVID at this point. You know, we have 82 total patients in Asante hospitals. And that is down from just a few weeks ago where we hit our high of 187. You know, we are also seeing similar significant declines in the number of people in critical care, as well as the number on ventilators. If you look carefully, you can see there is a triangle on the COVID total. You know, the very first, right underneath where it says 16% vaccinated, there's a single triangle there. And if you look at that, it says that's a child in the hospital with COVID. So we're going to talk more about pediatrics here in a minute. But we have seen our numbers decrease significantly, and we have not seen a sharp increase in pediatric admissions. So we're very grateful for that. Of course, the deaths have been hugely tragic, and we have seen a fair number of those, and honestly, a disproportionate share to Josephine County, which has been horrible and challenging for our staff and our community. Let's go to the next slide, please. So, you know, so that's the end of the chain, so to speak, you know, when you're talking about the hospital. So what we look at is the beginning of the chain, and the beginning of the chain is testing. And so we look at two pieces of that. One, we look at how many people are getting tested. And so our current daily average, our weekday average, is 395 in Jackson County and 146 in Josephine County. And that only makes sense in context. And so at our peak just several weeks ago, we were seeing close to 700 a day in Jackson County, and we were seeing over 250 to 280 a day in Josephine County. And if you were anywhere near that side of town, you probably saw the cars wrapping around the blocks and everything. And we were very grateful for the reserve folks that came in and helped us with that. That's been amazing. So that's one aspect that we look at. Let's go to the next slide. The second aspect that we look at is the prevalence rate. So of the people that we test, how many of those people are positive? And so if you're symptomatic currently for this last week, if you have symptoms, 16.4% of the time it was positive and you had COVID. That is down significantly. We were over 26%, like I said, just several weeks ago. And then for asymptomatic, and we do a lot of asymptomatic testing. If somebody's going to have a procedure, they're traveling, there's some other reason they may need a test. So we look at those folks a little differently. And right now our asymptomatic rate has dropped down to 2.4%. So, you know, out of 100 people, 2.5 of those could be positive in a room if they didn't otherwise have symptoms. Not long ago, that was close to 6%. So we have seen a significant drop on that. So we're seeing a very significant drop in prevalence in our community, as evidenced by a decrease in total testing, as well as a decrease in the prevalence in those that are tested, if that makes sense. So we're very excited about that. Let's go to the next slide. For pediatrics, we have seen an increase in pediatrics. Our weekday testing across Asante, this is both counties, is 132. So we're testing about 132 kids every day, every weekday. And the prevalence for them is about 16%. And as you saw, that's pretty close to what we're seeing for adults with symptoms. And of course, for kids, they're almost all symptomatic as they're coming through. So the prevalence rate is fairly similar. A few weeks ago, that prevalence rate was closer to 25%. So we're seeing a nice drop in that as well. Let's go to the next slide. The last thing that we look at is breakthrough cases. And breakthrough cases are people that are vaccinated that end up with typically a symptomatic case of COVID. And right now, of all of the positives we have, about 19% of those folks are vaccinated. What we see though from our first graphic, if you remember back, the blue dots, I didn't point that out, the blue dots on those graphics showed how many people are hospitalized and in the various stages. And with those, what we're seeing with Delta variant, which is the predominant variant for our region right now. With Delta variant, there is you're 5 times more likely to get the Delta variant, all things being equal, if you're unvaccinated. But you're significantly less likely to end up in the hospital, and even more significantly less likely to end up with serious disease and end up in the critical care or on ventilator. So, there is some risk of transmission from a vaccinated person, which is what I wanted to show with this slide. So, and that was a lot of data very quickly. Are there any questions? Overall, it's really good news. It's hard to believe that we have come this far so quickly. The models that they were showing in terms from OHSU and others, they said we would have a spike and it would be, end of August, 1st of September, first week in September. And that's kind of what we're seeing. And we're starting to see that come down. Interestingly, no, our census is still staying up, both at Three Rivers as well as at Rogue Regional and Ashland. And there's a lot of people still needing care.
I got a question. I couldn't figure out a way to raise my hand when you're sharing the screen. But is anybody tracking anything about the people that actually contract COVID, then get over it? And is there any breakthrough cases for people that defeated it naturally? And then how are they doing going forward?
So there's been a lot of studies on that. I am not the best person to answer that. And some of the studies, the reason I'm hedging a little bit is because some of the studies are somewhat contradictory. There's been some early studies that showed that natural immunity may not be as durable as a vaccine or as effective. And then there's also been some studies that come out and have said kind of the opposite. So I think time will tell. One of the more recent studies that I read said that, if you've had COVID and had a vaccine, you end up with a great level of immunity, kind of almost a super immunity, and it's been very effective against all variants. So, so let's see. Oh, I need to bring up the chats. I'm sorry.
So Luke, have you had a question? You've got your hand raised.
Yes.
Yeah, David Lutz here. I'm wondering, as we're moving toward flu season, what the current thinking is about balancing flu shots and COVID boosters. If you're eligible for, obviously for the flu shot, but for the booster also, is there any advice on which one to do first and how much time to let go by?
I have not seen anything specific in terms of guidance for that. I have heard discussions that some of the flu vaccine clinics may have both shots available, but I have not seen anything specific. I think that's an excellent question. And there was some discussion, I haven't seen anything recent about how COVID may be combined, and so it could be a virus vaccine at some point in the future, but I haven't seen anything recent. I think they're focusing on getting everybody vaccinated individually at this point.
Great, thank you.
And Valerie, you had a question.
You have a question. It's about carrying loads of COVID. is it true that if you are unvaccinated, the load that you carry is less than if you are, is more than if you are vaccinated? So does that make sense?
It does, it does. So I don't know that we can tell exactly the viral load, because what you're talking about is the viral load, is the amount of virus, especially in your upper respiratory passages where you might be spreading it. You know, I have heard that potentially for vaccinated people, that you might have a lower viral load because you don't get as sick, the virus doesn't replicate as long, and therefore your total load is less. I've heard that, I don't know for sure, but what I have heard that I think is an important implication is that you are contagious, your course of illness is much shorter, so you're contagious for a less amount of time. So even if you had the same viral load, you wouldn't be contagious as long. So there's a lot of interesting studies out there, and I want to make sure I'm as accurate as possible. And so I apologize for hedging on a couple of these.
Oh, thank you.
Another one, who can get the third shot and where?
So that's a great question. Currently, it's for immunocompromised folks, and I believe that if you are immunocompromised, and I think there was a recent release that they were talking about over 65, and I have not seen that recently.
That's true, David. I heard it on NPR this morning that the FDA approved it for 65 and older, but not for under that, unless, like you said, they have a immunocompromised.
Perfect. Thank you for that assist. I'd been hearing it for a while.
It's only Pfizer.
It is only Pfizer at this point.
Only if your first two shots were with Pfizer. So
that is correct.
Johnson and Moderna are not approved yet for the booster.
That is correct. And you know, a lot of the local pharmacies are giving the vaccine, and I know Grants Pass Clinic has a walk-in clinic, and even if you're not a Grants Pass Clinic patient, you can just walk in and get the vaccine and get the third booster as well. But you do have to sign an attestation form that you qualify for that.
Hey, there's another question. Do you give the monoclonal antibody treatment to people who are fully vaccinated but have a breakthrough case?
It depends. So yes, for the monoclonal antibody treatments are pretty amazing. And basically it is a process where we give people antibodies to fight the virus. And we are giving that in 2 locations, in Ashland and in Medford. And so you have to qualify for antibody treatment. So if you were 25 years old and had 0 risk factors, they are probably not going to say, hey, it makes sense for you to have monoclonal antibodies. But if you're 65 and are diabetic, they would say, yes, you are a great candidate for monoclonal antibodies, even if you've had the vaccine.
Okay.
So, but they do that on an individual basis, so.
Okay, thank you. Patty Toronto has a question.
I believe you're on mute.
Yeah.
Hi. I actually got the breakthrough COVID, and I was really, really sick, and grateful that I wasn't sick enough to go to the hospital. However, I called about the monoclonal, what you were just
antibodies.
talking. Yes, and they said that had to be done within 48 hours of getting COVID. And that, so when I called, the only place was in Ashland, and they said they were booked out for 2 weeks. And I thought, well, whoopee, guess I don't get that.
So depending on when that happened, that was, I'm sure that's probably exactly what happened. We started one of the first antibody clinics in Ashland in the state. And until this recent surge, it was not in use, and then it wasn't heavily utilized. And then with this recent surge, suddenly we ran into some challenges. And so we opened up the drive-through monoclonal antibody clinic in Medford next to the Black Oak offices there across from Rogue Regional. The challenge we had then was getting enough of the antibodies, the monoclonal antibodies, because everywhere in the nation we're asking for them and using them more. You know, in terms of the 48 hours, it really depends. I'm sure that, you know, you were talking to your provider and they look at your individual case. It can be anywhere from just a few days to up to 10 days in certain cases that they'll still give the monoclonal antibodies. So we have 2 very active monoclonal antibody clinics. And our challenge now is making sure that we have enough. But fortunately, with our decreasing prevalence, we're also seeing some decreasing use in that.
Thank you.
Absolutely.
And Deb clarified, says Rite Aid Pharmacy said they cannot give the 3rd shot. Only clinics and hospitals can't in Oregon.
Okay. Then certainly Grants Pass Clinic would be a great place to get your 3rd shot. I just want to add to that. Thank you, David, for giving this a report. And, you know, although the numbers are much better than they were, we're a long ways from being out of the woods. I want to be clear with that. You know, we like today, we are at currently just here at 3 years, we're at 95% capacity right now, which is the first time I've been able to say a number less than 100, which is helpful. But we are a very long ways away. And even the prevalence rates that David shared, they are down from the high, but they are still very high. Those are very concerning prevalence rates. They're not the astronomical numbers we saw before and we were experiencing, but we know that this will likely, you know, COVID's going to be around for a long time, and it's going to mutate into other things are going to change. And so we have a ways to go to get through it. We still need to be using all the precautions and all the safety things that we need to be doing. I never would have thought we got to the numbers that we were at, and it's so sad to see, you know, that chart with the we saw earlier is very, very challenging. And I just want to say thank you to our club for Operation Gratitude as well. I mean, our staff are so appreciative of Operation Gratitude and the love that you're sharing and showing to them. So I just want to say thank you for that.
Absolutely. I think the impact of COVID on our community and on our hospital cannot be overstated. And the love that you guys are showing is deeply appreciated. So thank you very much. It's a very powerful message to our teams. Okay. Well, thank you, David. Thank you, Wynn, for today's presentation, as well as what you continue to do on a daily basis to keep our community healthy and safe. I know we've got to do our part as well as a community. So thank you for that. And that's a good reminder. Grants Pass City Council update and Grants Pass Valerie.
Yes, I've got a couple things that kind of tie into that. One of the things is we were totally virtual in our meetings, but we chose to go back with more distancing on our part this next Monday and Wednesday. But we did ask, and we are asking the hospital to let us know what metric we should use to go to virtual totally. So we are trying to reach out to them and say, can you give us help us determine when is the appropriate time? So that was one thing. Another thing, sadly, our own Grants Pass Finance Department, I just got an email today that they are going into quarantine. So if you have anything with the finance department, you need to do it online or by phone because they currently have staffing issues due to quarantining. So it's definitely still out there. In terms of what the council is doing right now, a lot of what we're doing is behind the scenes. We're continue to work on housing, what we can do to increase housing. The funding for the rescue plan. We dedicated $3 million to bring down water rates so that we don't have to raise water rates to get our water treatment plant built in the future. There were supposed to be rate increases of 5% for the next several years, and those have been axed out. So that's important. But we're also sending out a survey to people, and there'll be some questions as to how you would like to prioritize the other $6 million. So we are in the process of getting that out. Urban Campground is kind of working behind the scenes. We're trying to find a way to make it happen. I know All Care is kind of stepping up to the plate there. So that's encouraging to me. We are very excited to see Foundry Village come forth and be a service that will, start happening here soon. And just through the planning, because I'm a nosy person and I always like to see what's going through planning. That's one of the joys of being a council person. I was excited to see Cathedral Square, which is a low-income housing project for disability and family, 1, 2, and 3 bedroom units that started through the planning process. And it is at the corner of Harbeck and Grandview, and that will be 56 units of low-income housing. So it would be nice to see something working, and hopefully we will continue to work to make more happen behind that. So there you go. If you have any questions, go ahead and ask. Otherwise, I'll pass the torch.
Okay. Any questions for Valerie? Okay, thank you. Thank you very much for that report. Foundry Village update. We had some things happen this week that were kind of exciting as far as landscaping. Who'd like to talk about that? Kelly?
I can talk about it. Yeah, it was the most amazing thing this last week. Who knew it was going to finish? And it has. Because we really started on this project months and months ago with planning and so on. And it's all about the volunteers. The volunteers really made this happen. And yeah, if you want to go by Foundry Village, you can see all this wonderful landscaping. And a couple people talked to me yesterday about that were from Rogue Retreat in Medford. And I think Val was with me. You maybe heard some of this, Val, or Tommy, one of you guys, because we had so many volunteers. And they were saying that what we have accomplished with landscaping is way better than what they were able to do. Now, part of the reason for that is because of all of us coming together and doing it. But another piece is that we own the property. They lease their property. And so they cannot do what we did. And so it isn't going to have that curbside appeal. And I think that's going to be really important with all the neighbors around there as well. So we are up and running. All the irrigation is done. Plants are all planted. Bark has been spread, and it's all good.
And they're painting and digging post holes today over there, so it's coming along well.
Yep.
Thank you. There was a question on there for Valerie, spending COVID money. Did I hear the council wants to spend it on jet fuel for Boersma?
Okay. I was thinking that was a joke.
I thought I read it.
Personally,
It is.
no.
Yeah.
No, I can't imagine us spending money. I think Travis can pay his own jet fuel costs at this point in time. So I haven't heard anything about that at all. So like I said, I was laughing because I thought, oh, no, I don't think so. I think that would be a big faux pas on the council's part to put money there. So that's my thought.
Okay. Thought you read it in the Courier, so got to get that clarified. Operation Gratitude, Jamie.
Well, I feel like Doug should actually be talking about this because I don't know if he's here or not, but the next project coming up, I think, will be Doug's barbecue out at the hospital on October 4th or 5th.
Yeah, Tuesday.
So he can, if he's here, he can talk about that. And then I will just say that our next mission is going to be the chocolate mission. And you will be hearing more about that soon. The deliciousness that is involved with that will be coming in an email, hopefully within the next couple of days.
So for not having anything to say, you had a lot to say there. So thank you for that. I appreciate that. Doug, are you on the call? I don't think he is. Anyway, October 5th, it's going to be from 11 a.m. to 2 p.m. at the hospital. And it's be cooking burgers. We've rented a barbecue and cooking. We're going to need about 10 volunteers because one of the things is we have to make sure that the volunteers, for one thing, have got to pass a food handlers course to do that. And I guarantee you, I've taken it myself just recently. It's super easy to do. And there's some good learning along the way as far as how to keep the barbecue safe. But 11 to 2 at the hospital. And so we'll have the supply of the food. And so we'll need some volunteers to help distribute that food. So if you can help out, talk to Doug. Let's see. So a couple other things regarding next Thursday. It's our last Thursday. We've got 2 events scheduled for that. The first thing is after the meeting, we're going to have what we'll call a Rotary Boot Camp Fireside. And if any new members or prospective members has any questions about our club, immediately following the meeting, you could just stay on the call and ask any questions about Rotary, our club, just a way to a really quick fireside to answer any questions about what might be going on regarding finances, how the foundation works, anything about that. And then also next Thursday at 5:30 p.m., we're going to have a Rotary Fellowship event, and it's going to be a Kahoot. That's Kahoot. And you'll need your cell phones to come to that event. And so what it is, if you, I've got 20 questions about Rotary, Rotary International, the foundation, and then you make a choice using your cell phone of A, B, C, or D, and we're gonna have some prizes to the person that, and there's 2 ways to get it. Number one, you have to, of course, get the answer right, and then the answer is fastest response time. And so you have a chance to answer these 20 questions about Rotary. And it's a really fun event. I don't know if anybody's played Kahoot before, but it's just a great way to have some fun and learn more about Rotary at the same time. And then after that, we'll just stay and talk about Rotary. But regarding that, here are some things that interesting facts about Rotary. Some of these you actually may hear on the Kahoot as far as being one of the questions. But regarding the foundation, in 1929, the Rotary Foundation made its first gift of $500 to the International Society for Crippled Children. And then Rotary first adopted the name Rotary International in 1922 when the name was changed from the International Association of Rotary Clubs. Rotary first established Paul Harris Fellowships in 1957 for contributors of $1,000 to the Rotary Foundation. In 1968, the first Rotary Club banner to orbit the moon was carried by astronaut Frank Borman, who's a member of the Houston Space Center Rotary Club. That'd be a cool club to be in, the Houston Space Center. I've been there before, the Space Center anyway. The first Rotary Convention was in Chicago in 1910, and there were 16 Rotary clubs attending that convention. The first head of state to address the Rotary Convention was President Warren G. Harding in 1923. The last one is in 1979, Rotary began a project to immunize 6 million children against polio in the Philippines. This led to Rotary making polio eradication its top priority. So there's just some interesting facts about Rotary. Let's see, does anybody else have anything that needs to be brought up about Rotary, our club? There's some people that feels like we should have a handicaps. There's about Rotary, so I can we'll try to figure that something out. Good thing is it's all in fun. Okay, so for our program today, I don't know which one.
Wait.
You bet. Oh, Patty, excuse me, you're on the list too. Yep, thank you. You got. Thank you. Go ahead.
Okay, so I'm going to give a short presentation. Deb is in band, so she's going to help me out, but let me see if. Okay, so I'm going to talk about Porch Fest and fundraising. So as a reminder, besides being a Porch Fest being such a great event, community event, it's also a fundraiser for our youth programs. So in 2019, we donated about $20,000, and that was mostly from our sponsors, some from some foundations. And then last year, we had to cancel pretty early in the fundraising process. So we carried some money forward, but we gave no donations last year. And this year, we want to give something. We don't want 2 years in a row to go without supporting our programs. This year, we're supporting CASA, which is an organization that represents the children that are in foster care and represents them in court, Family Solutions, mental services for children and families, and Project Youth Plus. And we had a presentation a couple months ago on that. It helps underdeveloped youth to thrive in school, college, and career. And I just want to tell a quick story. My granddaughter, Allison, works for Project Youth Plus. And when she first came to work, one of her assignments was to go, this is at Hidden Valley, was to go and find a girl that just kind of dropped out. They had online learning, the girl just not answering her phone, not going online, nothing. So Allison went out to the house and found out she was being raised by her grandmother, who had pretty bad dementia. It was a hoarding situation, and the young girl had no idea of who to call and how to resolve that. So Allison got the grandmother with social services, getting the things she needs. The girl went to live with one of the teachers at Hidden Valley. She graduated on time, and she spent the last year at Hidden Valley at RCC. So this is the kind of things that we need during the pandemic, is to save these kids that are falling through the cracks. So the 2021 situation, we knew that it'd be hard to get sponsors because of shutdowns and restrictions and shortages and staffing challenges and now the new surge. So we were looking at some way where we could cast a broader net and to tap into those individuals that that want to help us, that have not suffered. They've saved money due to spending less, and their investments have done well. So what we're asking these people, for those who can afford it, to give us $20. And this will be directly given to support our youth programs that I just talked about. And also, in addition, we will enter their name in a raffle and give them a wristband. And this is the wristband, and it says, make music, unite community, and help youth. So the process is, we've got about half the wristbands given out that Deb and I have gone to give to people. And we have instructions that go along with them. You get a little bag like this that has the ticket and also the wristband. And an envelope that you can put your filled in raffle tickets and your money. So who do you approach? And everyone has something different. I think Valerie talked about doing a lot of hers email. We have Patty Toronto sold an enormous amount of these in person, and Janie's put it on social media. So in addition, you can either donate. Some people decided not to participate and that are donating $200 to support our youth programs. Or you can subsidize. I had somebody that had $10. I gave it another $10, so they got to get their raffle ticket. So there's a lot of different ways to sell these. So the result is if everyone in our club gets 10 donations of $20, we'll have $10,000 to give to our youth programs. We're working with the sponsors that have either donated or pledged, and we're hopefully having about $10,000 from them. I still have about 3 that I haven't heard from. So that would give, if we do this, this would give $20,000 for our youth programs this year. Any questions?
Okay, Bev's got a question.
Yeah.
Patty, I don't know if you mentioned, but there's only so many we're going to sell, right? There's a max.
10,000 is the max we can sell.
Right.
I would like to have that problem of selling too much.
Thank you.
Valerie, you have a question.
Yeah, I just have a question because I came and picked up some more because I really do want to go out, but I wanted to make sure that I could sell the tickets right now that I still have. So I don't have to do anything different. Okay, thank you.
Right. And I have, you have the old bands. If you want the new bands, I can either, I can't drive because of my eyes. I can get somebody to drop them off.
Okay, that's great. I can come out. I know where you live now. So if I can do that.
Can I just say something? I think I'm unmuted. This is Kelly. Yesterday at Landscape Village, Deb Amin brought some out. And I don't know how I ended up with all of them. But I have a ton of them here. So Val, I've got them. So you can get some. I can't possibly get rid of all of these. So you can have mine, some of mine, okay?
Kelly, you were just lucky.
I think so.
I owe you an envelope. I apologize that I didn't give you an envelope yesterday. If you don't have an envelope, and Brenda, okay, Brenda Patton also.
Yeah.
Okay, great.
And
I just go ahead.
There's nothing special about that envelope, like Suzanne Levine sent her money in and just a regular envelope. That's fine.
Greg's got a question.
Yeah.
I was wondering if Patty or Deb want to give us a rundown of a couple of the great prizes that are to be raffled off.
Okay, well, I think the grand prize is what you've donated. Maybe you can talk a little bit about that weekend in Baja, California.
Margaret's the marketer. Margaret, are you on? There she comes. Margaret?
Okay, yes,
There
I'm
you
here.
go.
I'm just slow on the draw. So we're offering the use of our beach house over on it's actually Northern California, but it's just south of Brookings, a few miles. And I think it's, is it 2 nights or 3 nights, Greg?
I don't remember.
Yeah. Anyway, it's a beautiful place and we love to share it with others. And right now, I think Kay Moline and Jerry Holt and Sue Cohen are over there enjoying it from our Foundry Village fundraiser. So we hope that will be a draw for people to buy these tickets or buy these wristbands.
Thank you. And then we have Patty Toronto got a membership for Club Northwest. And then we'll have a priceless piece of art from our leader, Doug.
Yay.
And those are the prizes.
Cool. Patty, you have a question.
I do. This Patty, right?
Yep.
Yeah.
Okay. I've had a lot of fun with this. And one of the things that is always such a surprise to me is that people don't donate. The reason most people don't donate is because they're not asked. So it was really easy for me to put together, well, Patty Hansen put this letter together showing, CASA, what it does, Family Solutions and Project Youth. And I actually got brochures or little flyers from each one of those places. And my name is at the bottom of this, so it looks like it's really personal from me to some of my friends. But some of the things that just don't even think about are people in dinner groups, if you're in a wine group, if you're a quilter and you hang out with all those wonderful quilting ladies, or if you're knit, you got book groups, Bible studies, and the pickleball friends, tennis teams, bowling, and the Relic softball, that's for Greg Fishwick. Your insurance agent, your dentist, your accountant, your church groups. These are just so easy to put these little packages together and just hand them out and say, anything you do is just, we're so grateful to get it. And one of the things specifically that I said this year to my friends is that because of not being able to do this last year, that the need, because of COVID and people shut down in their homes, the need is even greater for these particular groups of people. If there's mental health problems in a home and everybody is stuck in their home, it's just going to exacerbate. And the things with the children in courts, with people being unemployed or underemployed or sick with COVID, that makes this even more important to help these specific nonprofit organizations. And just from doing that with just friends, I was able to get a little over $1,500.
You're up to 1,900, Patty.
Oh, well, there you go. I'm just saying, if you don't ask, you're making the decision for the person to say no. I mean, if you ask and they say no, that's one thing. You're no worse off than you were before. But if you don't ask, you're determining what that friend or that organization will do. We should let them make up their own minds, my opinion. Okay.
Okay.
Thank you, Patty.
Thank you. It was
and
fun.
Thanks for all that you've done with sponsors and individuals. It's amazing.
Thank you very much. Yeah, absolutely.
Nicely done, Patty.
Where should we send the money?
You can send it to me or to the Porch Fest PO box.
What's the PO box number?
Okay, I think it's 196. It's on the instructions that's in the Navigator.
You can download it off the Navigator.
Yeah.
Serena, by the way, happy birthday.
Oh, thanks.
Yeah, happy birthday.
I didn't reach out to ask a question for that, but thank you. I have been pointing people to the website when they're reaching out online, especially on Facebook. I went and I took the post that I made on the Porch Fest Facebook page and shared it to a few of the Grants Pass community groups. And we've had a few people reaching out to provide donations in that way. And so is that where you want me to direct people?
If they want to send in a check, yeah, I would say go to our send it to our PO box.
I think it links to the PayPal account on the website.
Oh, okay.
It has a donate button.
Okay.
Thank you, Suzanne, for setting up the donate button and being an amazing human. All right. So if that works, then I will continue doing that.
Yeah, that works.
Okay.
And where should people make the checks payable to?
Rotary Porch Fest. That's on the instructions too.
Okay, thank you. Okay, appreciate the effort. And we'll move into our program on the Josephine Community Libraries. And let's see, I think we've got a couple people on here representing the libraries. Who's going to go first? Brandis, is that you?
Yes, I am going to go first. Let me share my screen with you guys. Give me just a second. While I'm doing that, I'll let you know my name is Brandis Broho. I am the communications manager for our lovely public library, and I've been with the library since 2014. And towards the end of my presentation, I will also have Rebecca Stoltz, who is our Executive Director of the Library Foundation, share a little bit about what's going on with them right now. And if we have time, I'll do a quick little tour of the library's website so I can show you guys where to find some of this fun stuff. All right.
Okay, come on.
So we have branches, public library branches in Grants Pass, Illinois Valley, Williams, and Wolf Creek. Currently, all of our buildings are still restricted due to health concerns, but we are still offering curbside pickup on Fridays and Saturdays and tons of other services. So we'll get into some of that stuff. Our services during COVID, how we're meeting the community where they are right now, and how we're supporting community needs in partnership with our Library Foundation. Oh, let's see here. So ebooks and audiobooks have become very popular since the pandemic started. I don't know if any of you are ebook or audiobook users. I know I love audiobooks personally. Having a 3-year-old, I don't have tons of time to read physical books anymore unless I'm reading them to her. So the Libby app through the library, where you can get all of your library ebooks and audiobooks, has been awesome. I like to listen to audiobooks while I'm cleaning, doing dishes, cooking, and even commuting. And you can access ebooks and audiobooks directly through your smartphone, tablet, or your computer, free with your library card. It's a really easy process. Once you download that Libby app, you can actually check books out directly through the app. We also started instant online library cards so that folks could access library digital resources immediately, since our buildings are closed right now. And towards the end here, I'll show you where folks can sign up for library cards on our website and immediately start accessing those ebooks, audiobooks, and any other digital resources that the library offers. And thanks to our Library Foundation, all youth under the age of 18 who live in Josephine County, whether or not they live in the district boundary, do qualify for a free library card through their scholarship program. We have services right now like suggest a purchase. If there's a book, a periodical, an ebook, an audiobook, something from our Library of Things collection that you'd like to see but you're not seeing at the library, we do have a form on our website where folks can actually let us know what they'd like to see. And most of the time we purchase those items. We also, during the pandemic, started a personal shopper service, which we call Shelf Shopper. And it's just a form online, whether you're looking for an audiobook, a DVD, book for a family read aloud. If you just finished reading something and you want to find a similar read, but you aren't sure because the libraries are closed right now, all you have to do is fill out this form, and one of our great librarians will pick a selection of books, DVDs, items from our Library of Things collection that fit your needs, and we'll pull them and get them ready for you to come and pick up during curbside. We also have Ask a Librarian, which is available online, and this is an awesome feature. Sometimes a question comes up and Google just isn't giving you the answers that you need. Through Ask a Librarian, you just fill out an online form, and either one of our librarians from Josephine County or statewide will respond to you, and this service is available in English and Spanish. Library of Things has become really popular over the past few years. Essentially, we have a collection of items that aren't just books, anything from a sewing machine to an instrument. We have educational toys, Wi-Fi hotspots, and laptops even, which became really popular when all of our schools closed last year, that you can check out with your library card. This collection is growing and it's become really popular over the past few years. I definitely suggest checking out this collection. I know personally even, like I said, I have a 3-year-old, her tires on her stroller went flat, and I actually checked out our bike pump to pump those up from the library. We have tons of online learning resources. You can learn a new language, try a virtual knitting course, take self-paced social media marketing classes, or even get live tutoring for any grade level, free with your library card. That live tutoring has been huge over the past year. The Daily Courier just did a story on it. I believe it was a week or two ago. It's called BrainFuse Help Now, and they tutor from kindergarten all the way through college level, tons of different topics. They even do chess tutoring, which is kind of fun. Thanks to the Josephine County Cultural Coalition, we started doing adult craft kits that folks can pick up during curbside at all 4 of our branches at the beginning of last year, since we couldn't do in-person programming. Those have become so popular. We give out hundreds every month, and we actually do them for all age groups now. Children, teens, and adults have their own different craft every month, and we're continuing them at least through the end of this year. Our summer reading program just passed. I don't know if any of you saw our weekly ads in the newspaper during the summer. This is kind of an example of what they looked like. We partnered with local downtown businesses to offer the storybook walk in Cave Junction and in Grants Pass, featuring the book Harold and the Purple Crayon, which was kind of a fun passive program. Since our library branches were closed, this was our 2nd year partnering with the Grants Pass Daily Courier to offer a summer reading program during the pandemic. This was the first year that we actually had all of our weekly activities available in English and Spanish. I'm sorry about my dog drinking water in the background. They always, they know when I'm on a Zoom call, they either start barking or they get really thirsty every time. So during the summer reading program this year, we did a virtual summer reading challenge. And we had over 400 community members of all ages collectively read nearly 157,000 minutes this summer, which is amazing. Another thing that we were busy with over this past year is completely revamping the library website. We do consider it an online branch now. It's kind of our 5th branch. It is ADA compliant now, which is amazing. We have features like the Josephine Link Community Database, which essentially is an area where you can find up-to-date information for hundreds of community organizations, anything from legal assistance to senior services and more. And our librarians are keeping all of that information up to date for the community. The entire website is fully translated in Spanish, which we're really proud of. And we have dedicated sections devoted to children, teens, and their families, recommended reading for all ages, and resources curated by all of your local librarians through our subject guides. And here at the end, I'll do a quick tour and show you guys where to find all of this stuff. Like I said, we have library resources curated to specifically reach Josephine County Spanish-speaking and Latinx communities. So we took it a step beyond just having our website auto-translated. We actually curate information, links, books, recommended reading, specifically for our Spanish speakers. And if you guys want to stay connected with the library, you can find us on Facebook, on Instagram, LinkedIn. I've got the link to our website here. After Rebecca gives her presentation, we'll do a quick little tour. We also do have a monthly newsletter, and here at the end, I'll pop the link in the chat to sign up for our monthly newsletter in case you guys want to kind of stay in touch and see what the library is offering every month. Rebecca, are you ready?
I am ready.
All right, give me just a second. I will switch to your presentation.
So my name is Rebecca Stoltz, and I am the Executive Director of Josephine Community Library Foundation. Previously, I think I started back with the library in 2012 or 2013. So it is my forever home. I'm just working in a different capacity, which I really enjoy. So our library foundation, well, really quick before I get started with that, I just wanted to take a moment and acknowledge the Rotarians who are serving in library leadership roles. We have Gina Marie and Laurel, who are district board members, and then Doug Walker, who is a foundation board member, among many of you who are donors and volunteers to the library. So we really appreciate all of your support. So with that being said, the Library Foundation, we raise funds for programs and things that are beyond the library district's tax-funded budget, really with a strong focus on capital projects. We partner very closely with the library. When the library district passed and we then had stable funding, woohoo! We looked at not having to fundraise to keep our libraries open, but looking at our buildings and how we can fix our buildings if it's fixable, or look to other opportunities to provide more services for our community. So Brandis, do you want to hit the next slide? So working with the district, we had a facilities master plan created in 2018. And from that, the work that I'm showing you today is from that plan. So in August, we launched a crowdfund called New Chapters. We needed to raise $110,000 to finish the programmatic pieces of the Illinois Valley renovation. Our poor IV library, the building hasn't been updated since the 70s. There's issues with spacing or lack of it. Our roof needs to be replaced. There's some big concerns with that building. So thanks to these community members that are listed on the screen, Mayor Martell and the Cave Junction City Council, the library district is partnering with the city council there and applying for a community block development grant for $1.5 million to fund the renovations. State Representative Lily Morgan recently allocated $1.2 million to the Library Foundation, $900,000 to support and fund the renovation for the Illinois Valley branch. $300,000 of that ARPA funding is going to purchase land for a new Williams Library. Allcara Health, who has been a strong library supporter and sponsor and funder for many years. The Carpenter Foundation gave us a $20,000 matching grant. And then, of course, one of our community leaders in business, Southern Oregon Sanitation, and SOS came in on the last day of our crowdfund to make a considerable gift to ensure that we met our goal. And then an anonymous donor who provided a dollar-for-dollar match for all funds raised throughout the crowdfund. Brandis, if you could hit the next slide, please. So because of our community, we did it. And we not only raised the $110,000 we needed within that month, but exceeded it, raising $113,000. We're very fortunate that our community loves its libraries and has done so much to ensure that we have strong libraries in our community. So working with a local engineering company, ZCS, the renovation of the Ivy branch is going to cost about $2,510,000. And again, with the funding mentioned previously, if we get the community block grant, will be a funded project. So based on the community's feedback, we had a final conceptual plan designed which you're seeing on the screen here. What we really heard from the Illinois Valley community is that they need a meeting space. So the community room is going to seat up to 80 people. We'll have ADA designated restrooms. The teaching kitchen that we're really excited to partner with local businesses to provide some really unique programming out in the Illinois Valley. The computer area and the children's room are actually being switched. And this will almost double the size of our children's library at that in that building, which is great. We'll be able to provide a maker space, kind of early learning center opportunities. And then of course, there's the big pieces of seismic upgrades, repairing the roof, adding much needed electrical work and plugins so that there's access and Wi-Fi stations. So we're really excited to really see this project take shape. Do you want to hit the next slide? So what are we up to next? We're looking at purchasing land in Williams, a piece of property in Grants Pass for new buildings. Our Little Williams Library is a temporary building. Since 1977, it's been temporary. There's still no bathroom or running water. We have a little porta potty outside. And during the pandemic, we applied through FEMA to receive a hand washing station so that we can make sure staff out there had the ability to stay sanitary. Our Grants Pass building has just outgrown its size. The building was built in 1959 and it is still a county owned building. At one point they will want it back, I'm sure. A quick story is pre-pandemic, we had a dinosaur program here at the Grants Pass building. It was hugely popular to the point that we had to turn away kids that were dressed up in cute little dinosaur gear, excited to come to the library because there just wasn't enough room. We don't want to see that happen again in the future. So we need to build for the libraries 50 years from now. And it's really exciting to be part of that process. I know we're running a little past our time, so I'll just close there with, I'd love to talk to you more about the buildings and the work we're doing moving forward. So if you have any questions, please reach out. I'll put my contact information in the chat. Thank you guys so much.
Thank you, Rebecca and Steve. I know we're over time, so what I'll do is I'll just leave this screen up for folks who do want to check out the library's website. josephinelibrary.org is where you can go. Does anybody have questions for Rebecca or I about the Library Foundation or the Library District?
I don't have a question, but I just want to say, wow, this is wonderful what you're doing with these libraries, both Rebecca, Brandis, all of you. I'm honored to think that this is going on in our communities.
It's very exciting. Thank you, Kelly.
Valerie has a question.
And I will say the same thing Kelly said. I mean, so great to see it. As a matter of fact, I really did go online and realize my library card was blocked because it hadn't been renewed. So it's like it opens up a whole new world for me. Cheaper than me buying books. So that's great. But I also had somebody just recently I talked to who was not a part of the library district. And I thought to myself, you know, I would really, how do they, if they aren't in the district, but they want to join the district, do you have a process by which that happens, or how does that work?
Absolutely do. And we have information on our website under the library cards tab. But there are several options. They can either buy an annual library card, which is $60 for the whole year, and they can pay for that in quarterly chunks. They can annex their property into the library district, which is, I mean, that's the best, most sustainable option. And we do have some information about that on our website. They can also email us, and we do have a staff member who helps folks through that process. And then there's also the option always of signing up for a scholarship through the Library Foundation, and the Library Foundation has never turned anyone away. We've never said no to somebody who needs a library card and can't afford one. If they live in Josephine County, there is a way for them to get one and to access these services.
Okay, that's great. And I thank you, because what brought it about was they were asking about annexation to the city, because I didn't even realize how many people out there have not been annexed in, even though they may be getting services from the city. So that just kind of opened a whole nother window for me, and the library came up. So as we move forward in that, it is good to know that information. So thank you very much, Brandis. That's great.
Absolutely.
Any other questions? Brandis, Rebecca, Kate, everybody that happens to be associated with the library, thank you for the presentation, but more importantly, thank you for what you're doing. When you consider it wasn't that many years ago, we had a closed library in our community. I mean,
We've come a long way.
Come a long way.
We have come a long way, and it took a lot of people, a lot of wonderful volunteers and community members who got us to where we are now. So thank you guys. Thank you, Steve. And thank you to this Rotary group for letting us present and sharing what we have going on at the library.
Okay, thank you so much. Appreciate it. Let's see. Birthdays. Serena's is today. Happy birthday, Serena. Laurel Burkles was September 21st. So happy birthday to Laurel. And John Schiavone, Sergeant at Arms.
I don't see.
That's right. Well, we'll just do our own, I guess. Happy Bucks. Anybody happy today? Or things they want to celebrate besides birthdays or addition to birthdays?
Okay, I'm giving happy bucks. This is Kelly. I have 20 happy bucks for landscape at Foundry Village accomplished.
Okay, thank you. Valerie.
I'm going to jump in and match that, Kelly, and say $10. I was so happy to be out there. It was so nice to get it done in one day. I was totally amazed at the turnout. It was wonderful to see. But I'm going to put another $10 selfishly in, because I have a daughter who through the years has never made any money financially on real estate. And I was really worried because I went up to Portland last week to help her as she was juggling and preparing to put her house on the market, and it sold within 3 days. So I am very happy. I can rest knowing that. Otherwise, yeah, I was very worried. So it was wonderful to see that happen. She can move on with her life. So that's another $10.
Okay, Patty.
Yeah, I'd like to put probably 40 happy bucks in, because I went to the eye doctor yesterday, and after the horrendous journey from about December, January to now, I haven't been able to see or drive. And he, after several operations and other treatments, he thinks he can get me to 2020. And he ordered my glasses yesterday, and I can't wait to see. I'll get them in 3 to 4 weeks.
Congratulations.
Yay.
So I'm so happy.
Step forward. That's a wow. Okay, Tommy.
Yes, I have 10 happy bucks for all the great volunteers that were out there yesterday, and all the great volunteers that are making curtains. I wouldn't want to have to do all of them, but we've got a good crew on it. And I think that Lisa Higgins, who's not a member, and a couple other people that have just really put the time in, deserve great rounds of applause from our club. So,
Tommy, we're working on her. She's going to be a member.
Oh, good. Well, make it 20 bucks, because that's great what's happening.
Okay. You know, I'll put in 20 bucks for the volunteers, as well as a happy birthday for Serena. And she helped me with an article that I'm doing for the sneak preview, the back page on family solutions. So thank you for your efforts on that. I'm trying to tell the story a little bit more on help the organization out to build the awareness in the community. Let's see, anything else before we adjourn? Thought for the week from Simon Sinek. Focus on money and you will make money. Focus on impact and you will make an impact. And our club does a marvelous job on both, but the impact that we're making in the community is really, really gratifying. And thank you to each of the members of our club that are making a difference, as well as the community. I mean, we're truly a community club. So with that, we are going to adjourn the meeting. Let's see if I can put it. Okay. We'll stay on for a few minutes and chat if anybody wants to stay on. But again, thank you for the presentation today, as well as everything.
Bye. Thank you, guys.
Bye-bye, Brandis.
Bye, Brandis.
Greg, I have a question for you. When the district meeting on Zoom was hacked, did it have a password set up for that meeting?
I do not, well, yes.
There was a password. Okay.
Yeah.
No,
Steve,
there was not a password for that meeting. It was, they let you in. And so I think they probably let somebody in that obviously shouldn't have been let in.
Okay.
Okay, so it wasn't the,
there was no password.
We had to pre-register, if I remember right.
Had to pre-register,
right, Steve?
Right.
So we had to pre-register. So I guess it wasn't a password when we logged in, but there was a waiting room.
Right.
And
yep.
Okay. I'm sorry that happened.
Yeah, that's the first time. I think, Steve, you said the first time you've been in a meeting that got hacked too.
Right. Yes.
Yeah. I've heard stories, but
right.
it was no fun.
No. Yeah.
Well, and then a number of the announcements weren't made, like you, Greg Fishwick.
Well, I don't know where that came from. Somebody nominated me for something. Thank you.
Of service to the club. That's wonderful.
Yeah, I guess District Governor Cindy said that she did, after they closed it down, they restarted it back up and continued with the presentations, but probably not a lot of people knew to log back in.
I didn't. I just gave up at that point because I didn't even think that they would restart the meeting. I just thought it was over. But there was
right. I left early just because, I mean, as soon as like the second or third comment, I realized what was happening, and I got out just thinking, I didn't want to be connected to it.
Yeah.
I emailed Cindy because I thought it was so sad. I mean, the year that she had as district governor and all that she had done, and was really hoping to have an in-person celebration. And then for this to happen, was just awful.
Not only that, it was really going well. I mean, it was well orchestrated. They had, slides and things they were showing to honor people that had won awards for whatever, a picture of the building or whatever it was that was related. And it was really going well. I was surprised because it had a real personal feeling, even though it was on Zoom.
Right.
Yeah.
Well, I can't think of anybody who was more as a leader, a more fitting person to be a leader that year, because she really is a resilient and very flexible person and all about innovation. So
good.
Yeah.
Yeah, I think it was her comment, wasn't it? At the Steve, you were there with me. I can't remember, Dawn maybe too, with the visioning, where we were in on the visioning session for the district training assembly, which was on Zoom. And Cindy was the one who said, why don't we try to do something that we can make happen online and not have to do the, weekend retreats or whatever all else we were doing.
Mm-hmm.
And that's how we said, okay, what can we do?
Right.
I wonder why, the host does have permission to remove people, but were they not able to use that function? Or did they not know about it?
Yeah, it was that I wanted myself, and everything happened so quickly, I think. I don't think the operator that was kind of in charge of the meeting maybe knew that to do that quickly. And so basically, what are you doing? And I wouldn't want to take anything away from that person because it happened so quickly. And so bad.
I'm asking that because I want to know about if I'm running something and somebody hops in, I know that I can remove them and they can't rejoin. But if you guys, if whoever was hosting it tried to remove them and it didn't work, if it's like that kind of a hack job, I'm just kind of curious. I'm just kind of wondering for future events.
Yeah, Go
too,
ahead.
is you have to have the settings set up for that, don't you? I think there are like different settings in the Zoom meetings, and if you don't select them appropriately before your meeting starts, you can't retroactively.
I think that's true. Yeah. And I have that set up because I do a lot of them. I do a lot of them.
Hey, Dawn, I just wanted to say, I'm glad you're back in Grants Pass.
Yes.
Thank you.
Welcome
I'm
home, Dawn.
so glad to be
Somebody else
back.
might have said at the beginning. I'm sorry I stepped in a little bit late.
No, good to see you too, Kaver.
It's wonderful to be back. But the environment is so different. We woke up this morning and said, look at the trees.
They're green.
They're green, right?
They have leaves.
Yeah,
Not,
they're actual trees.
not pokey things.
Remarkable. That's right. It was kind of crazy though, because we got back yesterday afternoon. We picked up Henry, who's been at summer camp for 2 months. And then we had to go to a dinner party. So
tough luck.
It was like, oh, okay.
Did Henry remember you?
Yeah, well, it's so funny because the Potters, I mean, it's just been this whole letters from Camp Frosty Canyon that Henry sent every day. We had letters. And it was, I mean, he's had a wonderful time, right? And I wondered what would happen. And he looked at us and, he was really happy to see us, but he was happy being there too.